Range of motion. Active range of motion. For the assessment of the knee flexion, the patient must be in supine position. Instruct the patient to bring up the heel as far as possible to the buttocks. Normal knee can flex up to 135 degrees. For the assessment of the knee extension, instruct the patient to contract the quadriceps or to push the knee into the table. Ideally, the heel will lift off the table. Normal knee can extend up to 15 degrees. For assessment of the knee internal and external rotation, the patient must be sitting on the table with the legs hanging freely. The patient should be asked to bring his ankle outwards for external rotation and inwards for internal rotation. Normal external rotation can reach 30 to 40 degrees, while internal rotation can reach 20 to 30 degrees. For the assessment of the knee flexion, the patient must be in supine position. Flex the patient's leg to 90 degrees at the hip and fixate this position with one hand at the distal femur. Hold the tibia distally with the other hand and perform maximum flexion. Normal passive flexion of a knee should reach 130 to 145 degrees. For the assessment of the knee extension, the patient must stay in supine position with the legs flat on the table. Fixate the distal femur with one hand and grab the distal tibia with the other hand from the medial and perform passive extension. Normal knee should be extending from -1 to -5 degrees. For assessment of the knee internal and external rotation, flex the patient's hip and knee both to 90 degrees and fixate this position with one hand. Grab onto the foot with the other hand from the plantar and perform maximal dorsiflexion. Then move the tibia into internal and external rotation.